when talking about injuries and stretching is that there's this need or this thought that every solution to an injury requires stretching initially. And I agree. There are times when you definitely need to, engage stretching program to regain range of to, normal limits or, so you can do certain functional tasks. But I think we invariably aggressively stretch probably more, and we put too much reliance on stretching as the only solution to it. And you'll see this especially in the hamstring area. People will compulsively stretch, to the point where, they're so darn flexible. Their hands are on the floor, and they still think, well, I have to stretch a little bit more to make this injury, go away. And that soreness and tightness that you're, excuse me, experiencing oftentimes is actually a sign of weakness. Not necessarily a sign of something to stretch more. When you're going about your rehab and you're trying to treat yourself or take care of certain things, when you stretch truly something that's really tight, sometimes you're aggravating tissue that's trying to heal, especially the first, 1 or 2 days or 2 or 3 days after an injury or an incident where you started having a change in stretch. And that causes problems for, their power, their ability to jump. They've showed decreases in efficiency there. Then you take a tissue that you keep on a lengthening and it never gets enough strength. You never actually add that strength to it. It's almost at a mechanical disadvantage. So consider that when you go and you approach trying to self-treat. It kind of goes also with the same thing. If you're seeing a plateau for that length of time, then maybe stretching isn't really the solution to your problem. Not to maybe get rid of it completely, but to maybe add some strengthening, endurance work, other things that may really be the solution to your problem. You know, uh, it's kind of a multifaceted approach. Often, too, what I get concerned about is people stretching. Let's say we have an imbalance. One muscle's too tight, one's kind of weakened. If you continue to stretch the muscle that's say overly lengthened, you can keep the imbalance. You keep on stretching the one that's too long, and you're stretching it, making it longer and longer, and then the other side to kind of balance around your hip or your abs compared to your lower back. You're continuing to stretch something that's creating and reinforcing the imbalance. So consider there's a few different reasons why we want to kind of think stretching, could actually contribute to making the problem worse in certain areas. And in some areas too, we're stretching something that's not the origin of the pain. We're stretching an anatomical structure like the hamstrings, but actuality, the origin of the pain is actually up in the lower back, region. And really, what we need to stretch is that. I always give the analogy in the clinic that it's almost like having a heart attack and feeling it in your arm or feeling it in your jaw. People have gone to dentists numerous times and they were on the verge of a heart attack and they're actually having heart symptoms, but they're feeling it here, not actually chest pressure and things like that. So sometimes we're just kind of missing the boat. We're stretching something, like stretching my jaw for a heart attack. We're working on my jaw thinking that I'm going to take it. There's not originating from a structure in the jaw. It's actually coming from the chest. So referred pain can cause some problems. A lot of rotator cuff problems. People say, I've got pain in my elbow. I've got tennis elbow. So they do a bunch of tennis elbow stretches. And what's going on is actually originating from the shoulder. It's very confusing sometimes. And it can be confusing even for a clinician, someone that's working with someone. It looks like it. Sometimes it's even tender in the same areas, whether it be a tennis elbow or shoulder. They'll say, oh, it's a bicep tricep problem. So be aware if you're not having success through stretching and flexibility. I'm not trying to poo-poo it or make you feel bad, but maybe we're missing the structure that we need to work on, and that's something we should consider. So the word for the day is just, or the thought for the day is just be aware that stretching is not always a solution. Sometimes you have to add a strengthening component. I think in life, stretching is always equated to, taking care of an injury. So I hope this helps you out and kind of sheds a little light if you're struggling with a problem or an injury that, maybe incorporating some gentle strengthening could be a nice adjunct to it. And, if you have imbalances or other problems, you may be creating an imbalance or feeding into an imbalance that's already there. So I'd love to hear your thoughts of anyone that's on right now. I know we have a couple of people that are on. Any thoughts on that? And post them. How are you struggling with anything like that? Because or any topics you love to hear about. I'd love to post some things that have come up and that you may have some problems with and you want to understand. Maybe even stretching something's just not getting better. Please post the comments in here and I'll try and respond to as many as I can. Some situations are very specialized. You have to really do an evaluation. Other times you can give you some general advice on how to start moving better. And that's the goal is not to have to rely on pain medications, injections, all these things. There's a lot of things you can do with the right movement or exercise that can start making you feel better. And that's my mantra here at the clinic is there's a lot of things you can do the right movement at the right time. A lot of times I'll see patients from other therapists, and I think the therapist was on the right road. It was more the timing of it, or when do we introduce the strengthening? When do we introduce a certain flexibility exercise? And they just introduced it at the wrong time, or the patient didn't quite understand what they should be experiencing as far as the rehab process, why we're stretching, what our goals are, and if they match the patient, and make sure the patient understands. So a big part of what we talk about here, and if you're going to talk to a therapist, not necessarily me, but make sure you really educate them on what you're experiencing. Give them a ton of information, and hopefully that'll translate to you actually feeling better. There's a mentor, and I can't remember not mentor, but there's a phrase out there. Patients are telling us how to treat them, we're just not listening. So that dialogue and what you say can be just as valuable as an MRI or a X-ray, or even the physical, the exam. So just consider that. I hope this helps you out. Subscribe to our channel if you have an interest in hearing more things. We'll try and post some more things that are relevant. And please place something in the comments if you want to hear about a particular topic that you're struggling with. We'd love to add that to the list. I like to take new ideas. Sometimes as a therapist, we don't see that there are certain things that patients are struggling with that we're not as aware of, and I'd love to hear that from you. Listen, have a great day, and here's to you moving better and feeling better. Living longer if you're moving better. Okay, have a great day.